This session will be about resuscitation. Let's say this is a newborn baby and the first thing we do is an assessment. The baby may still be connected on the cord to the mother or may not. We'll talk about that. The assessment is, how is the heart rate and any breathing effort? Has it established respirations? So we'd expect a baby to do its own breathing between 1 minute and 1.5 minutes. So that means the baby at 10 seconds, 15 seconds, it doesn't matter, it's fine if it's a bit white or a bit purple or a bit blue. Sometimes we're jumping in too quickly thinking there's something wrong. We need to look at the clock and be really accurate and clear. How old is the baby before we give any help? There may be a background that you know the baby's heartbeat was very low in labour, or there was a hemorrhage in labour or some other risk factor and you want to help that baby sooner. That's fair enough. But generally a well baby at a normal birth, we don't need to interfere for the first 30 seconds, 60 seconds, so long as we're aware of the time. The things we're looking at is colour, tone, reflex, heart rate, respiratory rate. So where are we looking at the colour? In the mouth, the lips. Are the lips pink? If they are, that's reassuring. Is the heart rate over 100 or under 100? So let's say for the purposes of this it's 80 and it's going down 70, 60. So that's needing full resuscitation. We've got this option. We've called for help, somebody to call a telephone, an ambulance or any other help we can get. So we can come in like this, or we can have 2 fingers between the nipples. This way, there is a resistance of the table. Now the baby may be on the edge of the birth pool or on the mother, if we're resuscitating on the cord, may be soft. If I'm holding a baby, we will see the chin very likely falls forward. So that's going to be difficult for ventilation. Are you one person working alone? Are you 2 people? So let's go back to the beginning. A baby who needs inflation breaths before we give any cardiac massage, whatever the heart rate is. If we over tilt, no good. If we flex the head, no good. Because in this baby, the chest will rise. I've got a C grip on the base, an E grip on the jaw. That is an E. Tilting the jaw to sniff the air. And we get the chest rise. If I have a 1 kilo baby, maybe 1 finger, 2 kilo baby, 2 fingers, 3 kilo baby, 3 fingers. And if I'm giving slow, effective breaths, I can even act like a wave with the fingers. Now the rate, we're giving 5 inflation breaths. 1, 2, 3, 4, 5. And I could evaluate the baby in between, or better to get at least 2 or 3 good breaths into the baby. Probably the 5 really helps to push the fluid that's in the lungs. The lungs have never expanded, so the inflation breaths are unique and very special. This is clearly documented, illustrated on the UK NLS, November Lima Sierra, NLS guidelines about resuscitation. Now the rate of breaths is between 30 and 60. That's a great variation. So some of us panicking with adrenaline, we haven't taken our own breath, stop to breathe, we'll probably give more calm, effective resuscitation if we're breathing. If we're all frightened and going fast, you can hear the valve releasing, so it's not effective. We need the slow inflation breaths, 5 of them, and then the ventilation breaths can be 1,000, 2,000, 1,000, 2,000. So that would be a rate of 30. If I was just going 1,000, 2,000, 1,000, that's about 60. So between 30 and 60, there's no right or wrong. There's effective ventilation. Is the chest rising? If you don't have a bag or mask, you're going to cover the nose and mouth, or the mother or father might do this. First of all, I suggest suction. You may have a gadget for suction, whether it's a bulb rather, that you can have the tube in the nose, or I actually like gravitational drainage. If the baby's gone to the mother's chest, The bum is lower. By raising the bum, dropping the head, there's more chance of fluid coming out the nose and opening the airway. It depends what level of resuscitation. So a little bit of stimulation, the air is stimulating the baby, drying the baby, maybe stimulating the feet. At different levels, whether we even call it resuscitation or simply stimulating a baby who's a bit flat. So I said at the beginning, let's say this baby's got a heart rate of 80, 70, 60, called for help, done the 5 rest inflation breaths. If we've got the one that's on your arm, it's easier to be doing the breath. This is 100 a minute. Like any nursery rhyme, Nelly the elephant packed her trunk and said goodbye to the circus. Very fast. But even if you didn't do that, you just did some good ventilation, got to have chest rise, and even for those who've not done ventilation, but in reality have just done some cardiac massage, that causes a small amount of air to exchange, and that can be beneficial. Of course, this is much better to give between 25 and 30 mils of mercury pressure with a base of 5. If you've got a neopuff, unlikely at a home birth, although I met one midwife who carried one in the boot of her car, you can easily set the peak end expiratory pressure, the PEEP, as 5, and you just cover, and this is very easy to control. So you may want to practice resuscitation on different equipment and machines. The main thing is if you've just got yourself, no equipment, give suction, clear the airway, inflation breaths. You don't want to cause a punctured lung and pneumothorax, so you want to give less pressure rather than too much pressure, filling the cheeks like a trumpet player. And as we know, the air is 21% oxygen, we're breathing out about 18%. So the baby's getting something, but more than the oxygen, it's getting air and pressure into the lungs to open the alveoli, open the deep aspects of the lung. Maybe need to look at position, because when it's not effective, it's very likely the face is slippy. We need to dry the face and reposition our mouth or the bag and mask. So I've mentioned in a separate video about observation of respiratory distress. We could look at that link. Generally, again, we're back to looking at colour, tone, reflex, heart rate, respiratory rate, plus respiratory effort. Babies have fantastic abilities to help themselves, but they have very limited resources. So if a baby's already been having a hard labour, has come out possibly with secondary apnea, we don't know. We don't know what the cord blood analysis is, and even if we did, it can be a false positive, false negative. In other words, the numbers can be wrong. It could be a machine error, could be mixed up with somebody else's blood. It's the condition of the baby. How are they responding to resuscitation? If they're not responding, we continue. It's not somebody at the end of their life having a heart attack on the golf course, it's a baby, and ethical dilemmas about am I just keeping a vegetable alive should not be part of the equation. It's just keep doing all you can for as long as you can. If we're going to transfer to hospital, I've got a breadboard, a towel, maybe a muslin cloth, maybe carpet tape around, or I have a bag for transfer and silver paper to keep the baby warm, can wrap that around, and got the baby. If it has to go separate from the mother, we're going to do that. Of course, the best place is kangaroo on the mother, or turning the baby over if we can do resuscitation on the mother. It's difficult to keep the chin up on the mother. We may need a flat bed. Now, we might object to doing that, but if it's going to save a life, we do it. And of course, it was very wrong that we had premature cord clamping in hospitals, take the baby to resuscitate, and they even died and certainly did not do very well from that early intervention of premature cord clamping. Of course, it's better to keep the baby connected wherever possible. There are some situations we need to cut and run, scoot and shoot, get to the hospital. for whatever reason. That's up to you to decide. So I hope that's useful. It's quite fast, but so is what we do needs to be almost reflexes. So I encourage everybody, when you're watching a movie, play with your bag and mask with a doll and baby. How is effective. Maybe put some lubricant on a baby so you can feel the reality of body fluids making it quite slippery. That gives a lot more reality. So good luck to everybody. Thank you.